Hi there, my name is Brad Leach, and in this video I'll share how to formulate PICO terms and conduct a search in PubMed. Generally speaking, a PICO question has four major aspects: the population, intervention, comparison, and outcome. First of all, the population or patient group. This is generally here to describe key characteristics of the patient or population group. This may include the gender of the group you'd like to investigate, the age of the group you'd like to investigate, or the diagnosed disease. And in some cases may involve a combination of these elements. For example, one may want to explore Hashimoto's in adults or Hashimoto's in male adults. Intervention is self-explanatory. It may include things such as a supplementation or even a dietary change. Comparison is comparing the intervention to something else. This comparison may either be a placebo, it may be standard care, conventional care, or it may be a medication such as metformin. Whereas the outcome are the markers in which you are investigating the change. This may be particular pathology markers, a PROM, a patient-reported outcome measure, or other clinical outcomes. Here is an example. In adult patients with rheumatoid arthritis, is omega-3 supplementation effective in reducing pain and inflammation compared to placebo? Let's break down the four elements of the PICO question. First of all, you have the patient or population group. In this PICO question, the patient or population group are adults with rheumatoid arthritis. The intervention is omega-3 supplementation. The comparison is placebo. And the outcome measures we're trying to investigate is the reduction in pain and inflammation. Before you get started on conducting a search in PubMed, it is highly beneficial to do what we call a scoping review. This is where you search the literature to have an understanding of what is out there, what has been published, to have an understanding of, let's say, your inclusion and exclusion criteria, or whether or not there are studies using your described intervention and even your described comparison. One element of developing your search strategy in PubMed is these things called mesh terms. I'm going to explain to you how to develop mesh terms, where to find them, and the benefits of them now. Generally speaking, when you are searching for mesh terms, you'll go on to PubMed. There will be a link to the mesh database. You will search your term, you will identify the right term, and then you'll add this to your search builder. So let's see an example. Here we have PubMed. Down the bottom, right here, is your mesh database. Let's click on that. Here we have your mesh database. You can see that this is quite similar to PubMed database. However, you'll have up the top mesh and mesh here. Now, if we want to identify a mesh term for the intervention group, so in our example PICO question, we were looking at rheumatoid arthritis, omega-3, in comparison to placebo. So we need to identify whether or not there's a mesh term that can search all relevant terms in relation to omega-3. So let's just type in omega-3 here. As you can see, there are a number of different terms that may be used to describe omega-3. Now, the term that we actually want is up the top here. Fatty acids, comma, omega-3. So let's select that. Here we have the term. This is your mesh term. Fatty acid, comma, omega-3. When you search this term in PubMed, not only will it search for fatty acid omega-3, it will also search for all of these other terms to describe omega-3. You can develop and add this to your search builder by over on this side here, just add to search builder, and that will give you the term that you'll use when searching PubMed. Now let's look at our PICO question and the search terms that we will use. First of all, we have our population group. Now, our population group are adults with rheumatoid arthritis. So we are going to do the exact same thing we did for the omega-3, but for rheumatoid arthritis. So we would simply type in rheumatoid arthritis, and right here is our mesh term. Other terms that we will use to search the literature will be rheumatoid arthritis, joint inflammation, joint pain. The intervention group will utilize the mesh term fatty acid, comma, omega-3. We'll also search omega-3, fish oil, EPA, and DHA. The reason why we're having these additional terms in addition to the fatty acid omega-3 mesh term is, as you would remember, EPA and DHA and even fish oil did not fall under that category of fatty acid omega-3 mesh term. Our comparison will be placebo. Our outcome measures will be inflammation and pain. Now, when developing a search strategy, we've got things called an arm. Okay, for this particular PICO question, we're going to be utilizing a 4-arm search strategy. So let's see what that involves. To conduct your search in PubMed, head over to PubMed and then enter in Advanced. So you'll see Advanced just below the search function in PubMed. Within PubMed, you will start to populate this box right here with your search terms that were developed. And it will look a little like this. So there are a few important things to mention here. First of all, I recommend to utilize and develop each arm individually before making the final search. So here we have up the top the final search. But before we got to that point, down here at the bottom, we have the patient population search. So this is where we search for all of these terms to describe the population. All we did was we added these terms into the advanced setting. We added this to our settings and then got them ready to conduct the search. And we did this for 1, 2, 3, 4 arms. As you can see, there are many articles, and for us to sift through each of these manuscripts would take a very long time. Hence why we utilize and or. So you can see here that I've used or between these descriptive terms to describe our population group. Rheumatoid arthritis or joint inflammation or joint pain. Utilizing or will identify articles that either have joint pain or joint inflammation as a term within the title and in the abstract. Similar with the intervention arm, the comparison arm, and the outcome arm. As you can see in the final search, we have utilized the word "and." When we utilize the word "and," that is, we want articles that have the term inflammation or pain and placebo and omega-3 and rheumatoid arthritis. This way, rather than searching through all of these manuscripts to identify the articles that meet our inclusion and exclusion criteria, we are left with 23 articles. One last thing to mention here. I generally advise not to include the limitation on year or on studies conducted on humans just yet. You'll be able to identify the year and the studies that are conducted on humans during your screening process, as you only have 23 articles. However, if you do this final search and your results are above 100, then you would add in the limitation of within the last 10 years and studies conducted on humans. Thank you for listening, and good luck with your PICO question and search.